Welcome to Blue Water Health's pre-surgery intake and assessment class for patients receiving hip replacements. Today you will learn about your surgery, what to expect after surgery, and how to prepare beforehand to have the best outcomes possible. At the end of this presentation, there will be a short quiz to make sure you understand all of the information. Please take a moment to listen and then read each slide before advancing. Preparing for surgery. Preparing for surgery. Hip precautions. Following surgery, there will be 3 movements your surgeon does not want you to do. It is important you follow these restrictions to make sure you avoid dislocating your new hip replacement. The first precaution is not bending your hip past 90 degrees. This means no bending down to pick up objects from the floor, no bringing your legs up to tie your shoes, and no sitting on low chairs where your hips are below your knees. The second precaution is not crossing your legs. This means in a chair or in bed. Some patients will be asked to buy a special pillow to use to avoid allowing you to cross your legs while sleeping. The last precaution is no twisting or rotating. That means you must make sure to not twist or reach for items. You must take small steps when turning, and you are not to rotate your feet in or out in bed. Equipment needs. There is a lot of helpful equipment that will improve your independence after surgery. The occupational therapist will recommend equipment for home based on your functional status after surgery and the surgeon's recommendations. This may include a standard walker, cane, crutches, toilet seat or VersaFrame, shower chair or tub transfer bench, reacher, a long-handled shoehorn, a sock aid, and elastic shoelaces. Rental purchase locations. There are a few local stores that you may be able to rent or purchase the equipment from if needed. They are listed on this slide. If you are from out of town, please review the stores in your local phone book or research them online. You can also sometimes find equipment through a local Legion service club or from family and friends. The Red Cross no longer rents equipment. Surgeon-specific equipment needs. A few of our local surgeons require you to purchase an abduction pillow. This is the pillow mentioned earlier in the presentation. It is used between your legs when sleeping, so you avoid crossing your legs. If you're required to have this item, your surgeon and/or their office will let you know. Driving and car transfers. Typically, you will not be able to drive for 6 weeks as per your insurance policy after your surgery. Please get direction from your surgeon regarding when it is safe for you to drive again. We have listed some advice on how to enter your vehicle. Community supports. Before your surgery, you may want to arrange for transportation. If you anticipate you may have difficulties or you live alone, you may want to look into assistance with meals or prepare meals before your surgery. You could also consider asking someone to stay with you or stay at their home if you have a difficult home to get around in. Home and community care. Home and community care are able to help you navigate any concerns you may have after you discharge home from the hospital, including respite stays. For more information, please contact Home and Community Care at 1-888-447-4468 or visit eriestclairhealthline.ca. Exercises. Before your surgery, you can do exercises to strengthen your leg to prepare for and make it easier after surgery. Please make sure your focus is on exercises within your pain limits before surgery. While in hospital, parking. Blue Water Health has parking available with a maximum daily rate of $7. You may wish to purchase a parking pass before surgery if family is planning on visiting you daily. Pain control. After surgery, our goal is pain management, not elimination. The team will provide you with pain medication to keep your pain under control and allow you to complete your rehabilitation. After surgery. Your rehab team will provide you with equipment to use while in hospital, including a reacher, shoehorn, standard walker, and equipment for you to do physiotherapy exercises, as well as learn strategies for personal care tasks. Please do not take this equipment home with you when you leave. After you arrive back on the floor that evening, the nursing staff may get you up into a chair or help you walk to the bathroom. Walking. Physiotherapy will assist you in regaining your walking after surgery. Most people use a standard walker. The pattern is always walker forward first, then step with your operated leg, then your non-operated leg. After surgery day 1. The morning after your surgery, occupational therapy will complete an assessment as well as review your functional transfers, strategies for getting dressed with hip precautions, home management techniques, and car transfers. They will also identify any additional equipment you may require for home at the time of discharge. After surgery day 1, physiotherapy. Physiotherapy will get you up and walking. We will review the orders from your surgeon and let you know how much weight you're allowed to put on your operated leg. We always bring a chair when we are going down for therapy for safety. After surgery day 1, exercise. We will complete the exercises that are pictured here on your first day in therapy. We will measure how much bend you have in your hip joint and write it on the board in your room for your surgeon to review. After surgery day 2, you will continue with the same exercises as day 1, but we will increase the amount of repetitions and practice the stairs. Stairs. We will practice the stairs with you. All you need to remember is up with the good and down with the bad. While in hospital, discharge day. Patients usually discharge home day 2 after their surgery, not including the day of surgery. For example, if your surgery took place on Monday, your discharge date would be Wednesday morning after therapy. Your nurse will review all discharge instructions, and occupational therapy will review equipment needs prior to going home. After discharge. After discharge physiotherapy. After you are discharged home, you will be expected to continue the exercises you were doing in hospital 3 times per day. Please continue to walk with the standard walker and do not start using the cane until you are advised to by the physiotherapist you are working with in the community. Outpatient physiotherapy. Please review this slide about arranging outpatient physiotherapy. All patients should have a physiotherapy appointment booked before surgery within 10 to 14 days from the date of your surgery. If you're coming back to Blue Water Health, we will set up an appointment for you before your surgery. What to expect. What to expect. PROMs, or patient-reported outcome measures. You will be asked to complete some surveys along your journey with us at Blue Water Health. They will take less than 10 minutes to complete, and if you are asked, we hope you will be willing to complete the survey. Incision. Your incision will be closed with staples. The staples will come out approximately 14 days after your surgery. You will have a bandage on your incision when you leave the hospital, and it is to stay on and only come off if it gets wet or falls off. Please monitor your incision for signs and symptoms of infection and notify your surgeon if you are worried you might have an infection. Please refer to your total hip replacement booklet for a complete list of signs and symptoms of infection to watch for, which can include increased swelling, redness, and fever. Gait aids. Most people quickly transition from a walker to a cane, and by 4 to 6 weeks, most people are not using anything to help them get around. Pain. Please use your medication, rest, and ice to manage your pain. You should expect to have some pain, swelling, and tightness for 6 to 8 weeks after surgery. Quiz. Please take a moment to take the quiz below and test your knowledge on your upcoming surgery. Thank you for participating in the online education session for your upcoming total hip replacement. If you have any questions, please contact Adrian at phone number 519-464-4400, extension 8100.